And if you feel like that your child has any of these symptoms or a multiplicity of these symptoms, then I would encourage you to take them to a professional and have them evaluated. You can do that by taking them to a physician. You can take them to a licensed professional counselor or some other professional who can give you a professional and clinical judgment as to what you're looking at. For a child and parents, ADHD is got to be, and it is, disruptive, confusing, frustrating, bewildering, anger-provoking. It tends to destroy the child's sense of self-esteem. And really what I work with lots of times is not just the child's self-esteem. A parent's self-esteem also tends to be eroded and destroyed with this disorder. It also has results in that it can limit a child's ability in academic performance. So this is most distressing if you have a very intelligent child who is trying to cope with ADHD but cannot quite get there. So they need assistance. It might involve tutoring or something like that. But the academic area is an area that we're going to talk about a little bit more too. Current research is showing some additional areas of problem. Now some of this is going to be new for you, and that's good. It probably is embedded in some of the things we've talked about. And so we will just kind of go over that real briefly. Working memory. In other words, children have difficulty remembering what they're trying to do. They cannot retrieve their memory when they're supposed to. They have disorganization in their thinking. They lose track of the goal. Say mom comes and says, hey, clean up your room, pick up your shoes, pick up your socks. She comes back in a few minutes. The shoes are gone, the socks are in another part of the room, and she's saying, well, what didn't happen? Well, most everything didn't happen, but the child doesn't know that because he's already forgotten what the instructions were. Another thing that we see in these children is they act without hindsight and foresight, which means they don't seem to be able to learn many times from past behavior, and they don't adequately consider the implications of future behavior. And one I like that I really have stumbled onto in doing this research is they don't use time the same way other people use time. They don't have the same sense of time. So they frequently are late to events or inadequately prepared. Another thing that we see is problems with an internal language, that is our internal speech. That's what we use to correct or command our behavior. And this is really private speech. But without such speech, how are you going to know what's right or wrong? So there's some moral implications in this for these children. They have difficulty regulating their emotions, motivation, and their arousal, which means they have trouble inhibiting their emotional reactions. They're less able to stop themselves from acting. When they're frustrated, they just come across as being immature, even to their peers. They have trouble generating interest or motivation for tasks without immediate payoff. Therefore, they appear to lack discipline or willpower. They seem sometimes to be in a fog. A term that's been coined for this is sluggish cognitive tempo, meaning they don't keep up the pace as they should. They have greater than normal variability in task performance, which means that they have a wide variation in their ability to complete a task in the quality, quantity, and in the speed of their work. They're not balanced and they're not consistent in patterns of productivity and accuracy many times. Sometimes they're extremely accurate. Sometimes they're erratic. It's very frustrating for the child or the adolescent and even for the adult. How do we treat ADHD? Well, we can't cure it, so we try to manage it. That's how we treat it. I would encourage you to make an appointment with an LPC, a licensed professional counselor, or refer your child to a physician for a medical evaluation if you hear anything in here that is distressing to you. All the research shows that properly diagnosed ADHD responds well to medication. There are a number of different types, and they are targeting now, they're good enough to target some of the predominant behavior patterns, and we're talking Vyvanse, we're talking Cylert, Strattera. A physician also, as well as an LPC, can rule out other disorders with similar presentation. However, a physician will not generally have time to treat the other symptoms. So medication alone can't do the job. It won't get at the psychological distress of the child, the distress of the family, or the academic environment of the child. Somebody has to go in and deal with that. And that's generally where counselors come in. We generally will do something like behavior modification in both the school and the home setting. So we have techniques for using reinforcement to change a child's behavior. And those techniques, usually we target the most problematic behavior first, and then we go after that behavior to show a change. Also, I'll use a written contract, which is very specific in the contingencies that are used. If you do this, you get this. If you fail to do this, the other contingency is you will not get this. So the rewards and consequences are clearly spelled out. Another thing that we try to do with dealing with families is to help child and the family manage their behaviors and help the child internalize these behaviors in such a way that they can better manage in the future. Another thing these children seem to have is social skills problems. So social skills training becomes an issue that we want to emphasize. I conducted a social skills training group this past summer dealing with ADHD kids. And what we did is we studied, practiced, and role-played behaviors such as introducing yourself, how to deal with being teased or bullied, and avoiding conflict. Counselors are involved in educating additionally the parents and the child. So we maximize study times, we give study tips, and we give classroom strategies. We also are involved in helping parents understand their educational eligibility for special ed. Generally, we're talking about individual education plans here, which is a system in which the parent and the school have to agree